A single heartbeat under 1 second is a relay race precise to the millisecond. 7 or 8 ion channels open and close, one after another in strict order. Today, we reassemble every channel this season has covered into one complete action potential curve to see its 5 phases, from phase 0 to phase 4, and exactly who governs each. Understand this one picture, and every earlier episode fuses into a whole. Start with phase 0, the upstroke. It all begins with ignition. The fast sodium channel INA flings wide open. Sodium pours in like a tide, and within a millisecond or two the membrane voltage shoots from -85 millivolts up to +30. This is the trigger of the heartbeat, fast, fierce, and brief, the steepest stroke on the whole curve. Right after comes phase 1, a small notch. Just as it reaches the top, a channel called the transient outward potassium current, ITO, opens briefly, lets a little potassium out, and nudges the voltage slightly back down, carving a small dip. Don't underestimate this notch. It sets the starting height for the plateau to come. Then phase 2, the plateau, the most distinctive stretch. Here a tug-of-war plays out. The calcium channel Cav 1.2 opens and calcium pours in, pulling the voltage up. At the same time, the potassium channels IKR and IKS push potassium out, dragging it down. The two forces are evenly matched, so the voltage hangs high, forming a long plateau. The late sodium current INA-L we discussed also meddles here. The length of the plateau all but sets the length of QT. A tug-of-war always ends. By phase 3, the calcium channels gradually close, potassium efflux takes the upper hand, and the voltage slides swiftly back down. This is repolarization. The lead is played by IKR, carried by hERG, the star of episode 1, plus the backup IKS. This phase is also the main battlefield where most drugs cause trouble and QT gets prolonged. Finally, phase 4, rest. The voltage falls back to -85 millivolts, pinned firmly by the inward rectifier IK1, holding steady on this horizon, motionless, quietly waiting for the next ignition. As episode 6 showed, loosen it and the ground shakes. Now lay them all on one picture and you understand a full heartbeat. INA ignites, ITO carves the notch, Cav 1.2 and IKR, IKS tug on the plateau, hERG leads repolarization, IK1 guards the rest, and late sodium INA-L stirs trouble in the shadows. One heartbeat is this relay of 7 or 8 channels, precise to the millisecond. Let any one of them fail or be quietly disturbed by a drug, and this curve deforms, and the heart can fall into a lethal rhythm. That is exactly why we measure them, one by one. The season's full family portrait of channels is now complete. Next time, we go inside patch clamp itself to see how much information hides in a single raw recording. Follow Channel Observatory and we'll take them one channel at a time.